Good evening. The long-awaited report looking at Ontario's response to long-term care homes throughout the COVID-19 pandemic has finally been released. The lengthy report showing what most advocates say they already knew, that the Ford government was not prepared for a pandemic leading to thousands of deaths. Over 300 pages describing how Ontario's long-term care residents were failed by the province.
I picked up the report, I read through more than 300 pages and put my head down and cried because it told the story of the abandonment that people were facing.
The report outlining what went wrong pointed to the province's lack of pandemic preparedness. It also highlighted the poor state of the long-term care sector, something that wasn't properly addressed for years.
It is a horrific wake-up call. At the same time, it's a surprise to almost nobody.
In just over 6 months, the commission interviewed over 700 people and reviewed thousands of documents. The report found Ontario's policymakers failed to take sufficient action, despite repeated calls for reform resulting in the suffering of staff and residents, and in some cases, death.
It was completely predictable that we would have another outbreak. It was completely predictable that staffing would collapse, that there would not be the resources that we need to respond. All of that was true before the pandemic happened, and yet this government did not take the steps needed to correct that.
The commission found numerous governments failed to learn lessons from the SARS epidemic in 2003. It says poor facility design and resident overcrowding only made things worse.
We can really see very concretely not just what we need to change in future, but what was done wrong right now.
The report comes 2 days after the Auditor General found similar results in the province's lack of preparedness. The recommendations being made now include reforming the business of long-term care to rely on private sector investments for building infrastructure, but restricting care to mission-driven entities modeled after the hospital sector. They're also recommending that building management be taken into consideration when new facilities are being built.
We need to fix the system now, and we need to make sure that the system is not a medicalized system. Recommendations 58 and 59 talk about the importance of emotion-focused, person-centered care, and also to make sure that we think of seniors care as a continuum. Home care has to be part of this solution.
The Ford government has yet to respond to the report. Over 3,700 long-term care residents and 11 staff have died due to COVID-19 since last March. Now, if you want to check out the full report, we have a link to it on our website, citynews.ca.